disabilities as such, what are the early signs parents and teachers should look out for?
The early sign, like visible sign to the teacher, is mostly the child is not sitting in the class, is the first sign, and he is not able to mix with the peers. The number 3 is not able to follow the instructions, and number 4 is it can be the name calling response. Whenever when the teacher calls him, he is either looking here or there. So whatever is that, whatever it's
Distracted.
yeah, distracted. Number 5 is not able to follow the instruction, not able to follow the blackboard. And this is a little bit like maybe the education, the academic part, like not able to follow, doing this, repeating the same spelling mistakes again and again. Calculations are a little bit difficult for him, and these are the common signs what I remember right now.
But I feel that there is pictures here. I think so, Ashman, you probably agree that this whole assessment, right? The earlier we pick up therapeutically, when I refer the child to you, you probably can do a better work, right? Than, people getting into a denial, hita hochche na, let's wait till so and so time. So in this, I think so very objectively, if you look at the immunization cards, or the booklets which have now been given to every citizen of this country, okay, even from the government sector, you have milestones which are well elaborated pictorially and in the vernacular, so that, nobody misses out. So you are given milestones according to the age, and you're also given the red flag signs on the other side, right? So it really doesn't matter that you do not know how to read and write, okay? You can still follow that booklet, and if a social smile doesn't develop, if a visual fixation doesn't develop, if a name calling or response to simple one-step or two-step commands don't develop, probably our index of suspicion increases, and if we can refer them to the therapist ASAP, rather than waiting for the child to be admitted to a preschool or to a mainstream school and then discovering the issue, that is where we probably need to focus on. That early diagnosis, early picking up of the signs. And in a small session like this, if I were to reel off a list of symptoms, the listener is going to panic, right? So let us be objective. So if you are going to a pediatrician who is giving you an immunization card, he or she, it is imperative, should be giving you certain milestones that you should be looking for at the appropriate ages. It could be 6 months, it could be 9 months, it could be 1.5 years, 2 years, 2.5, 3 years. And if as a parent you are concerned, you should address that concern to the pediatrician. And that is how we pick up things much earlier, and we can put them on the right path.
So actually, being inspired by what you just said, how much of a deterrent would you feel denial is to treatment?
Well, Mekhla, this is something, in medicine, when we are taught communication skills, life doesn't flow in a very smooth pattern for anyone, right? Okay. And we come to junctions in our journey of life where we have to break news to the patient, so-called patient, here could be a parent, which may not be very stereotypical, okay? Or pertaining to our discussion today may not be neurotypical, right? So this breaking of the news is an art which we all need to develop. We need to layer it out, and we must realize we are dealing with human beings. They aren't robots. They are going to be in denial. Think about yourself or myself. If somebody were to give me a diagnosis of cancer, I might be the most educated person in this world, but I have a heart. So I am going to be in denial. I am going to think, why me? So it will be a deterrent, but it is as much a deterrent as any other medical issue that we are dealing with. And we've got to find a way of getting them on board and telling them, I think so, this is what Oshiman also says, because a lot of my patients go to him, is that if you sit on it, you'll be there. But if you stimulate your child, you don't know where he's going to land up. He might be one of the most brilliant technicians. He might be one of the most brilliant minds moving around. So to explore that potential, the message is, yes, people will go into a denial, but once we educate them about the potential of this child through an accurate diagnosis, as he was, just elaborating, only then we can tell them what is the potential of this child.
Absolutely. So in what ways would you say the current education system is dealing with a situation like this? Do you think they are supportive, or there's more inclusion required?
I think there's more of inclusion is required, because they are doing their best, in the sense like they are supportive to these children as well as, but they need a little bit more support, like inclusion of more of IEP, like individualized education plan. And like another thing which is like special educators needs to be there in every school. And I would say like and few misconceptions about, like, if the child is not able to perform after 6 or something, after class 6, or they maybe easily go for a dropout. So to stop this dropout, rather than if they help with the assistive technology or something like that, I don't know whether this goes to CBSE or ICSE, whichever the boards is, if they're able to clear it out. So why don't they just make it a little bit ease, like the syllabus was for them? At least maybe they are not getting 90%. At least if they get 60%, still they will make something. They will do something in the later in the life.
So what would you say?
Yeah, I mean, your question is actually very, very pertinent. But before we answer that question, I think what we need to realize is we are not in utopia. We are in our country, which has its limitations, both resource-wise, education-wise, and the numbers, right?
Sure, no.
So what, the CAMS in the UK can do, the Child and Adolescent Mental Health Services in the UK can do, even if you bring those brilliantly trained people and put them amongst the Indian population, just the sheer numbers would, put a strain on them, all right? So the education policy is tailored for a particular country, and there has to be an amalgam of integrating them into the mainstream with early diagnosis, training of the teachers, ongoing, advocacy programs, giving them services under a roof, which Oshiman does so brilliantly, all right, okay? And also, we need to understand that while we are integrating them into a mainstream, we need to give them their special needs also. So if somebody needs half an hour more to complete an assignment, if somebody needs more explicit instructions to complete an assignment, that has to be given to that child. Today, even in a normal, neurotypical school, if say 3 of us are in a class and we are given a mathematical problem to solve, none of us are going to be doing it at exactly the same time. I might take a while longer. So I need the time to come to grips with it and form a solution. So the educational policy, there are, efforts which are now going on to, as he pointed out, to have individualized plans, but we still have a long way to go, miles to go, before we can say that we can integrate them into the mainstream. And where required, there has to be also special attention paid to the special needs of these children.
According to you, what would you say are the common misconceptions regarding autistic individuals?
So when it comes to autism, the first thing that I face as a question is that if I have the first child who is autistic, will I have the second child? And should I even plan? And would it be something like, I will face the same situation? So the answer is actually not a simple answer in these cases. As we look at it, that autism in about 40% of the cases may have a genetic background, which may or may not be inherited. So we have to separate genetics from inheritance. Everything genetic is not inherited. Sometimes we do have mutations or changes that can happen in the individual by itself, which is not sort of got from the parents or inherited from the parents. And in these cases, if the child has it, it's a new mutation. And in such cases, the chances that a second child will have this particular mutation is very less. In very, very rare cases, there are also situations where the family actually has different kinds of manifestations. Like you will see schizophrenia, you will see different kinds of neuropsychiatric mood disorders. And in these kind of the families, the answer becomes a bit difficult to answer, because in these cases, it is heritable. It might come up as an autism and a mood disorder behavior, but it may or may not have a single gene which is responsible. What we understand right now, there are small other genes, there are oligogenic effects, which can actually influence the outcome of whether this, at what spectrum of the mood behavior or neuropsychiatric issues or behavior issues this person is. So we have to evaluate, and there is so much we can evaluate. There's no straight answer for this, but in 40% of the cases, as documented by the American Association of Pediatrics, we do get a change. And in those cases, we might be able to guide the parents for that particular genetic issue. Understand, autism is a spectrum disorder and it is heterogeneous. So there's also gene-environment interaction. So we cannot say that you will never have a second child with autism. What we say is that your risks might be lower if there is no genetic etiology.
Right. So